Yeah, well, there's an increasing evidence of the fact that immunotherapy has greater efficacy the earlier the stage of disease. We have growing evidence first from locally advanced rectal cancer with Dostarlimab. The Octubre trials have shown really incredible high complete response rate in these patients that were traditionally treated with chemotherapy, radiotherapy, and also very radical surgery that has major implications in patients' quality of life, particularly if it even implies a live colostomy. So in this Dostarlimab trial, the response rates are so high, and with more follow-up, we see they are sustaining time and avoiding all these standard of care procedures that are really more toxic and a lot more cumbersome for patients. So, of course, we need more higher number of treated patients and longer follow-up to see whether this means cure of a high proportion of these patients or not. We still need to be a bit cautious on this, but certainly it is already included in clinical guidelines, not only in US guidelines, also in ESMO guidelines recently. And this is very important for patients. Not yet approved though by EMA, but I think it's certainly a strategy that deserves to be approved with current data. And we've had now also some recent updates of the first proof of concept trial by Luis Diaz in the 3 cohorts of 2 MSI and 1 MSS cohort. And with 10 years follow-up, they show that complete responses really are sustained in time, and that late relapses are really exceptional. So these are really very good news for our patients, and this can be also extended to colon cancer locally advanced. Of course, in this setting we have less data or less mature, but the Nietzsche trial shows have a high proportion of complete or major pathological responses. When it brings up a little bit the increase, the difficulty of assessing properly complete response, clinical complete responses when you don't have a pathological specimen, in order to be able to avoid surgery. So there's a lot of work going on in this field, and it's really very exciting for our patients, and it's certainly going to change the standard of care, that's for sure.